What's up, beautiful people? Another day, another study. There has been a lot of interest in blood biomarkers that can be used to predict Alzheimer's pathology and also predict Alzheimer's diagnosis, and that we can monitor for cognitive decline or cognitive improvement. This is great. This is an area that's heating up, and I think that will be part of routine care here very soon. So this study was looking at two different blood biomarkers and using them in a way to see how well they're able to diagnose Alzheimer's disease. So they're suggesting that we break these into two things: core 1 biomarkers, and these are things that predict Alzheimer's pathology, while core 2 biomarkers, which are a proxy for tau tangle pathology, are used to monitor disease staging. What we know is just because you have Alzheimer's pathology, like let's say, for example, on autopsy, doesn't necessarily mean that you develop Alzheimer's or cognitive decline. There's a thing that we call resilience, cognitive resilience. Tommy Wood calls it headspace, where certain activities or behaviors are protective against the development of dementia, even when we have dementia pathology. So p-tau is one of these core 1 biomarkers. It's elevated without cognitive decline in those with Alzheimer's related pathology. However, this EMTBR tau 243 represents aggregated tau tangles and serves as a core 2 biomarker. So this study evaluated the use of both of these to support Alzheimer's diagnosis. This is really important because not all dementias are Alzheimer's dementias, and other dementias may respond to different treatments. And then a secondary aim was to examine whether these markers predict cognitive decline over time. So the diagnosis of Alzheimer's disease was made clinically through imaging or biochemical markers. 350 of 572 participants were positive for p-tau. 341 of these were positive for amyloid markers on CSF PET, and then 199 had Alzheimer's disease. So that indicates a positive predictive value of 57%. And then among p-tau positive patients, 194 were tau 243 positive. So this yielded a positive predictive value of 84%, a negative predictive value of 77%, a sensitivity of 82%, and overall accuracy of 81%. And those who had longitudinally elevated tau 243 levels performed worse on cognitive tests at baseline and over time. So this is really four important aspects of a test. We want to know, if you have it, will you test positive? If you don't have it, will you test negative? If you test positive, do you actually have it? And if you test negative, do you actually not have it? So this is what studies like this try to figure out. And now what we need is replication across different population bases. We need to see this in other studies as well. So that's what I'm hoping is on the horizon. That's what I'm looking out for. And it's really cool that we're starting to see these markers for cognitive health, brain health being developed, where we don't have to stick really long needles in people's spines.